Located just off Newberry Road as part of the North Florida Regional Medical Center are the Neurosurgical Specialists of North Florida. They provide comprehensive neurosurgical care using cutting-edge technology and advanced techniques.
Myself and my team practice neurosurgery and neuroscience here at North Florida Regional Medical Center. We handle patients that come in through the emergency room and or through our clinic, folks that have either brain or spine disease. Patients and families often ask if there are signs or warnings. You want to pay attention to some of the more obvious things. Weakness on one side of the face or the body, trouble with numbness and tingling in the arms and hands, or difficulty walking, new onset headaches and pain. When we're trying to diagnose something that's going wrong in a person's brain, the initial few minutes of an interview with a patient tells us a lot. We can usually identify what parts of the brain are in trouble. The next step is that we get imaging of the brain, so it's either an MRI or a CAT scan or sometimes both. The human side of dealing with brain disease is something that we spend a lot of time thinking about. Someone who has a brain tumor that comes in is more than just a technical problem. They need to be taken care of at so many levels. That can mean emotional support. It can mean preparing the patient for the complexities of the surgery. We need to have them know that every step of the way there's someone looking out for them.
So I woke up on a Wednesday morning with a severe headache. Continued to get worse. On Friday, went into the emergency room. They did a CAT scan on me, came back with a large tumor in the brain. Dr. Scher was called into the ER, told us what he believed it was. I had an MRI and had surgery on Saturday. So we're about 10 months out since the surgery. I believe I'm a walking miracle. I'm very thankful to Dr. Scher and North Florida Regional for the excellent care that I received.
I'm a stroke and interventional neurologist. I specialize in various different types of stroke. We're able to meet our patients at the door and offer any treatment for acute stroke, whether it be a clot-busting medication to reverse stroke symptoms or whether to offer a procedure to restore blood flow to the brain. We also see patients in clinic. Those are patients who may be concerned about their stroke risk or have suffered a stroke in the past and they want to know why they had a stroke and how best to prevent further strokes in the future. We were recently accredited as a comprehensive stroke center, and that's the highest level of stroke services possible. In addition to that, our door-to-needle time is excellent. That's the time it takes for a patient to go through our front doors and get treatment for an emergent stroke. It's in the mid-30 minutes. So the procedures that we offer for ischemic stroke are minimally invasive. We enter the body through the leg, track on through the blood vessels up to the brain. Most patients cannot feel anything that we're doing. The recovery time is minimal. Often patients are able to stand up a few hours after the procedure. So it's very important to know the warning signs of stroke. So a mnemonic to remember is FAST. Facial weakness is an early sign of stroke. Arm weakness, speech changes like slurred speech, they should prompt T. Time to treatment is key. The earlier that we treat strokes, the better patients do. So FAST.
Spine-related issues can be quite debilitating for patients, both young and old. They interfere with their ability to do things. Their quality of life is compromised. In terms of the spine, some of these warning signs include things like severe pain in the back, especially that wakes the patient up at night again, new onset of numbness or weakness in the arm or leg, or any problems controlling your bowel or bladder. These are all warning signs that shouldn't be ignored. Here at Neurosurgical Specialists of North Florida, we do complex spinal instrumentation for a variety of pathologies, problems such as rheumatoid subluxation, severe arthritis, and we instrument the spine basically from the base of the skull all the way down to the sacrum. We deal with traumatic injuries where there's weakness of the spine or dislocation. We also deal with spinal tumors, both primary tumors and metastatic tumors. We take great care to make sure we do a full clinical assessment of patients because many times that'll give us a clue as to what exactly is going on with the patients and also gives us a clue as to how urgent a problem it might be. We then order appropriate diagnostic tests, both imaging and lab tests. We try to provide both surgical and non-surgical care as appropriate. And especially in the spine, we try and pursue conservative measures as much as possible. Many times you can get by with things like cortisone shots, epidural steroids, facet blocks, combined with physical therapy. Physical therapy is sort of the mainstay of a lot of spine-related problem treatment. But if that fails and patients do need surgery, and again there's a whole range of surgical options from less invasive to more invasive, appropriate and timely treatment of spine problems is important for overall health. It promotes increased mobility, which in turn promotes better health.
The team at Neurosurgical Specialists of North Florida is committed to providing the compassionate, comprehensive, and innovative treatment each patient deserves.